Hey everybody, this is Dr. Osborne, founder of Gluten-Free Society, and today I have a special interview with one of our medical board of advisors, Dr. Jack Wolfson. Dr. Wolfson, thank you so much for being on today.
Oh, it's my pleasure, Dr. Osborne. I'm so excited to talk about a topic that is absolutely crucial for all people to know about, certainly as it pertains to cardiovascular health, and that's gut health. And certainly gut health starts with a good diet. And I really appreciate everything that you discussed regarding gluten and grain and really bringing the awareness to the public.
Yeah, so tell us a little bit about your academic and clinical background, because I know you've got a lot of experience in this arena. So share with our audience a little bit more about who you are and how you've trained.
Yeah, sure thing. I'm a cardiologist like my father before me. He went to osteopathic medical school, internal medicine, and through cardiology fellowship, and I followed in his footsteps. So I did 4 years of medical school, 3 years internal medicine, 3 years of cardiology. And then I joined the biggest group in the state of Arizona. And in that group, I became a senior partner. I was the director of cardiology at one of the local hospitals, the chairman of internal medicine, director of cardiac rehab, and doing all the angiograms, pacemakers, hospital-based cardiology procedures that a typical cardiologist does. And in fact, in 2011, I was awarded by my peers one of Phoenix, Arizona's top doctors. So along the way, in around 2005, I met the woman who would become my wife, and she is a doctor of chiropractic, or as she says, DC, doctor of chiropractic, DC, doctor of cause. And she said, listen, we got to, you have to really open up your eyes to becoming a doctor of cause as well. It's not about the pharmaceuticals. It's not about the surgeries. It's about really getting to why people have health issues. You have to learn about nutrition and lifestyle and natural ways to live in order to heal people. And that was just, it was such an epiphany for me because we had never learned any of that through all that medical training and then through, a few years on the job. We never talked about nutrition in all of my training. We never talked about the importance of sleep and sunshine. We never talked about any of that stuff. And when I saw the sickness all around me in the hospitals and my patients, and I saw the sickness in my own family, of which my father would eventually die at the age of 63 of a neurologic disease called PSP, which is similar to Parkinson's. And when I started to look at, all the causes of what happened to my father, I said, what you have to say makes total sense. And I started to change my entire life and change my practice.
That's amazing. So you come from kind of both worlds. You started in cardiology, doing all the procedures, prescribing the medications, really kind of the opposite of root cause, and then went from that into really looking at fundamentals, diet, lifestyle, as being a path to health and wellness.
Yeah, and it really became, so exciting. And it's so unfortunate for so many medical doctors that, again, they haven't come to the realization yet. They're still plugged into the medical matrix where it's all about making a diagnosis and then what is the pharmaceutical or surgery or test that they're going to recommend next. It's never about talking, really giving any substance to conversation about nutrition and lifestyle. And it's really unfortunate, but then, that's why I'm so excited to, join you on your endeavor and really open up the eyes of the people to the dangers in so many different arenas, but certainly as it applies to food. And, that's why I love your book, and I love what we're doing with Gluten-Free Society, where we're really talking about gluten, where as a medical doctor, I only learned about it in regards to celiac, but again, celiac, of course, is the absolute tip of the iceberg. And then when you break it down below that, you see so many people with gluten and certainly grain issues.
Now, you wrote a book, The Paleo Cardiologist, and I know a big part of your recommendation when you're treating people naturally with heart disease and heart issues is really to change their diet and move them away from gluten and grains. What was your initial experience that led you to looking at diet a lot more closely? Was there an event with a particular patient that you had just like radical change in their life, or what kind of got you into the research around gluten?
Well, once again, I'm going to throw the credit back to my wife, because back when we met in 2005, one of the things we started really talking about was nutrition. And again, we didn't get any medical training at all in nutrition. And I do remember, though, when I was a cardiology fellow back in the year 2000, I saw a debate between Dr. Dean Ornish of low fat fame and Dr. Robert Atkins of low carb fame. And I walked out of that 45-minute debate where there was probably 15,000 people in the room listening to these guys. And I walked out of there again. I was a low carb acolyte, but even then I really didn't gravitate, towards it. And only upon meeting my wife, and then she starts talking about this concept called leaky gut. And I said, leaky gut, where'd you come up with that diagnosis? I went through all this medical training. I've never heard of leaky gut. And she said, well, go read about it. Well, at the time, there wasn't necessarily much to read. I did talk to a lot of holistic doctors, much like yourself, and what they had to say made sense. Well, as you know, certainly over the last 10 to 15 years, the medical literature has exploded on the concept of leaky gut. And now we have so many amazing tests that we can do that help to confirm that diagnosis. But at the time, I started reading books such as, Why Stomach Acid is Good for You by Dr. Jonathan Wright, medical doctor. And then I started reading about the Mediterranean diet. And then I picked up the books like Neanderthal by Ray Audette, and certainly Weston A. Price Foundation. Weston A. Price was a doctor in the 1920s, as you know, who traveled all around the world with his wife, and they go to all these native Paleolithic cultures, and he studied their teeth, he studied their oral maxillofacial features, and found that those people that followed their Paleolithic diets, as opposed to quote unquote the local white man's food, those people that followed their natural diets, their health was extraordinary compared to those who, again, were eating the white flour, the white sugar, and all the heavy grain. So in that kind of context, that's what really got me interested in paleo nutrition, certainly paleo lifestyle. So I wrote the book, The Paleo Cardiologist, and yes, we discuss a lot of nutrition, but it's also about that Paleolithic lifestyle, trying to live as much as we can like those hunter-gatherers, and that's how we're going to achieve the best health benefits.
What have you seen in your practice working with patients directly with different types of, major cardiovascular disease in terms of diet change? What kind of turnarounds versus, let's say, I know you coming from both fields, so you've really got a unique perspective. You treated people, you put in stents, you prescribe medications. What have you seen in terms of outcomes, one side versus the other, diet versus medical therapies?
Yeah, well, since 2012, I started my own practice out in Arizona, Wolfson Integrative Cardiology, and I got to tell you, Doc, that I've seen everything. I've seen everything improve, every cardiology diagnosis improve when we improve the diet. And again, I am a very strict. I'm very strict about two things. Everything has to be organic and everything has to be gluten-free. But when I tell that to people and they start to follow, what we find is that inflammation invariably goes down. And inflammation is linked to every cardiovascular disease, whether it is hypertension, it is elevated lipids, it is coronary artery disease, atrial fibrillation, cardiomyopathy, stroke, you name it, it's tied in with inflammation. So if you lower inflammation, you will lower the risk of those conditions. And I have seen it, hundreds of times, if not thousands of times over the last 8 years, where we are able to do so many amazing things. We're able to get people off of blood pressure drugs, cholesterol drugs. We're actually able to make improvement and reverse coronary artery disease and improve heart function, improve recovery after a heart attack or a stroke. So we're doing some really, really fantastic things, and nutrition is a big part of it.
That's fantastic. What do you feel like is the number one holdup, for mainstream doctors not recognizing the power of a gluten-free diet or grain-free diet? Is it just a lack of training as they go through school? Is it what would you speculate? Because you had the courage to come out of, you were you had a very lucrative career. You were in charge of a department. Like, that took a lot of courage to walk away from that. And it was the right thing to do, in my opinion. But why do you think, some of your other colleagues haven't made that jump or leap?
Well, I think, like you mentioned, it is multiple different factors. Number one is correct. We just don't get the education. So it's not even something that we can debate in our minds what is right or wrong. We can't even have the debate because we don't even understand, that there's a question. So that is fundamentally number one. And then number two, if you do get some training, or if you did want to pursue nutrition as able to advise your patients, you could easily take the default, well, people aren't going to listen anyways. People aren't going to listen about diet. People don't follow diets. So you can take that excuse as well. And then number three is that, it's a very money-driven profession, speaking certainly of cardiology or neurology or gastroenterology. These are all very lucrative professions. And as sad as it sounds, and I don't mean to be sarcastic or disrespectful, when your paycheck revolves around you seeing a lot of people, getting them quickly out of the office, using pharmaceuticals, doing procedures, you just don't take that approach that to go after the cause. And again, one of the leading causes of cardiovascular disease and all disease is nutrition. It's not the only cause, but it is a major factor, and it's something that's very easy to modify.
No doubt about it. Easy to modify, but takes a lot longer and a lot more heart to teach it and sit one-on-one with a person. How many people in your practice, per day when you're in your practice, do you see?
Yeah, I see, when I'm in the office, I see between 10 to 15 patients a day. As before, I was seeing between, 40 to 60 a day between the office and the hospital rounds. And I want to say two more things, too, Dr. Osborne, and I'm sure you'll agree with this as well, is that most people, and certainly most doctors, really don't practice what they preach. So in order for you to talk about nutrition to patients, you really have to live it yourself in order to make it an effective, communication, in order for that to philosophically, I think, to sit right with you. So again, if you are an overweight cardiologist, and the group that I left, I would probably say 20% of those doctors were obese, and then probably another 30 to 40% on top of that were overweight. So again, if you're an unhealthy physician, it makes it much more difficult to teach that to your people as well.
Yeah, absolutely, no doubt about it. What would you say? What key piece of advice would you give somebody who's stumbling across gluten-free society? Maybe they're just coming on to learn about the gluten-free diet. Like, what would be like the critical piece of advice that you would leave them with today?
Well, I think certainly is like we discussed, I've seen thousands of patients and talked about this type of nutrition, and we've seen dramatic weight loss going gluten-free. We've seen normalization of blood pressure, again, heart rhythms recovering, heart function recovering, abnormal lipids, kind of like inflammation certainly. And again, it's very, once you start to correct inflammation, it's like everything else starts to, fall into place. So the answer is that it's doable and it works. And I'll tell you this, when I met my wife in 2005, I was eating like most medical doctors eat. I was eating fast food. I was eating, just a lot of artificial food, certainly a lot of gluten containing grains. So if me, and I'm originally a Chicago guy, you know, the home of deep dish pizza and Italian beef sandwiches and hot dogs and everything on buns and bread. If I could change, then I truly believe absolutely anybody can change. And it is, I think it's become a lot more simple because as doctors like you have educated the world, well, now people are demanding more as consumers, and now we get better products that are gluten-free, not necessarily grain-free, but for those people that want to go pure gluten-free, it can be done, and you can still kind of have your cake and eat it too. And I think really, as you've taught in your books and in your information, that kind of that next level is to really kick out all the grains in general. So even the gluten-free grains, I think really takes people to the next level. But I think if you're looking to start out, if you want to go gluten-free and you want to go organic, I usually think that that's really just a fantastic foundation that's really doable for everybody, and especially for the children too, to indoctrinate that and start them into it, because as you and I both know, gluten is the cause of so many issues amongst our children.
Absolutely. Well said. Well said. Well, Dr. Wolfson, thank you so much for being a part of Gluten-Free Society and our mission to help educate the world and bring tools and realistic advice that can help them overcome major gluten-induced diseases. We appreciate your position on our advisory board, and thank you for your expertise.
You got it. So thank you. Thank you so much for having me as a part.